Hello and welcome to episode number 4 of Ask the Longevity Doctor, the show where I put your questions on aging, longevity and health to a medical professional. So my name is Chris Kerwin. I'm a master's student at University College London, where I'm specialising in cell and gene therapy. I'm also a research analyst for Gowing Life, and I will be hosting the chat today. And I'm joined again by Dr. Oliver Zolman.
Hello, yes, I'm Oliver Zolman. I'm a medical doctor based in Cambridge in the UK, and I'm the founder of 21 Consulting Limited. And our company's goal is to reverse aging by 20 years in all 78 organs using gold standard markers like imaging devices and biofluids by 2030.
So throughout this episode of Ask the Longevity Doctor, Ollie will be answering all our burning questions about stem cell treatments, tissue regeneration, organelle replacements, and organ rejuvenation. So as always, if you have any questions, put them in the chat and we'll get to them at the end. So Ollie, why don't you tell us a bit about replacing lost cells and lost cell parts and why it would be the key to unlocking our longevity?
Yeah, so let's start with putting it in context with the previous episodes. So replacing lost cells and cell parts is a level 3 category. And there's 3 longevity levels, level 1, 2, and 3. And normally for level 3 therapies, you should be doing level 1 and 2 already. And yeah, so each week we're trying to cover a different topic, one from level 2, one from level 3, one from level 1, each week. So yeah, why is it important? Well, because with age, both your cells decrease in number or quality, as well as your organelles. And your organelles are the components within inside the cells, such as lysosomes or mitochondria. And so one example, which is very important, is a paper, I think 2 or 4 years ago, which came out, and it was a 110-year-old woman, and they measured how many hematopoietic blood stem cells she had. So these are the stem cells which create your red blood cells and white blood cells, and they live in your bone marrow. And they found she had basically two left. So just run out of stem cells completely when you're meant to have thousands of them. So I think the normal range for a HSC count is around 50,000. That's one example. But similar principles apply to other organ systems in the body. But it's not always that you're decreasing in number. So mesenchymal stem cells don't really decrease in number. So that same 110-year-old woman, she may have had the same number of mesenchymal stem cells, MSCs, that I have, but the problem is they're not functioning properly or they're damaged.
So when we talk about stem cells, what are stem cells and what makes them so special?
So stem cells are cells that can give rise to different types of other cells. So normally, say you have a muscle cell, right? Maybe it can divide into other muscle cells, but a stem cell can divide into, so for example, mesenchymal stem cells can divide into FAMCO cells. That's the acronym I use. So they can become fibroblasts, adipose cells, muscle cells, cartilage cells, and bone cells, osteoblasts and osteocytes. So as you can see, stem cells become different types of cells. And the other difference between stem cells and normal cells is that stem cells they have telomerase active often. And this allows them to divide indefinitely, hundreds and hundreds of times. So for example, a hematopoietic stem cell, it can make, trillions of red blood cells all the time. simply because it can divide so many times initially and not wear out. Whereas other cells, they normally wear out after like a couple of hundred divisions, maybe, or less, because their telomeres shorten. These are like the bits on the end of the DNA which get damaged as they divide. But stem cells don't. Generally their DNA doesn't get damaged as they divide. So that's the difference between stem cells and normal cells. And there's a lot of complex terms we could talk about, like omnipotent, totipotent, pluripotent, multipotent, but it's not that useful for this podcast because it's very detailed, but we'll have some notes on that. And they're so important because they have this power to create new healthy cells naturally in the body.
So what you touched on there, I mean, the aging of the cell, let's talk about that for a little bit, because we know what aging looks like at a macro level. You know, we get wrinkles, our hair goes grey, but what does aging look like at the cellular level? And what does stem cells have, like, what is stem cells' role in this aging of cells?
Yes, I've got a good slide on this. So this is the longevity level 3 list. And basically these are the 9 aging pathologies that occur at across the body at a cellular level. And you can see category 1 there is restore lost cells and cell parts. So this includes stem cell, tissue, organ, and organelle replacement therapies. And yeah, as I was saying earlier, a lot of cell types, stem cell types, just decrease in number as we age because the stem cells aren't replacing them. So the stem cells may be decreased themselves in number as well, or they may not be being activated and functioning possibly. And this, category 1 in level 3, it interacts with all the other 8 categories, and vice versa. So it's a complex process, and the best thing to do is treat all 9 categories and all the subcategories within them. And that's the best way of theoretically reversing aging in every organ by a lot.
So when you say treatment, what do you mean by that? As in, what is stem cell treatment, and what types of stem cell treatments actually exist?
Yeah, so stem cell treatment is nearly always going to be an injection or a surgery of some sort. So because you can't really eat stem cells, so you'll just kill them, and you can't really, rub them into your gums. Not going to work. You can possibly inhale them through the nose in an inhaler format, and also through the lungs. But of course, that's kind of limited to targeting the brain, the nasal cavity, and the lungs, and trachea, and bronchioles, and pharynx, and larynx. So that's only like 5 or 6 organs, and you're not going to get great penetration like deep into the brain. It's quite complex to do that. It could be easier to just inject it. So other than the inhalation or possible, skin creams wouldn't really work either. It's inhalation or injections, unfortunately. So not the best, most comfy routes of administration. But yeah, so it's going to be an injection, and there's literally hundreds of stem cell therapies available already around the world. It's because it's been a very well-funded industry sector. There's literally hundreds of randomized controlled trials which have been done for probably around 100 different indications. Many of these showing very positive results, most of all in musculoskeletal stuff. And what types of stem cell treatments exist? Well, commercially, the most common ones are mesenchymal stem cell based, and there's three types of stem cell treatments. There's autologous, allogenic, and xenogenic. So autologous means it comes from your own body, and then you take them out, isolate them, you can enhance them or grow them up in culture into a larger number, and then re-inject them. Allogenic means it comes from someone else. So it could be a twin, it could be a family member, like a young family member donating to an older family member. It could be from a registry. So like in Japan, they have a huge registry with every tissue type for all types of stem cell therapies. And that's very common because the advantage of allogenic cells is that you can get it off the shelf, and it can be genetically matched to you. So it's not necessarily going to cause an immune response if you inject it into you.
So why is that important? So you say it creates an immune response if you have stem cells that aren't necessarily related to you.
Yeah, so we have a blood type, we have a tissue type. So you can't mix incorrect blood types, and likewise you can't mix incorrect tissue types. And for tissue types in humans, that's called the HLA type. So each of us will have, me and you will have a different HLA type. And we have to make sure the HLA type matches very precisely between us. And there's roughly around 100 to 200 main HLA types. So what you need is a stem cell bank that's either going to be genetically modified to suit everyone, like O negative blood. And there's a way of doing that called HLA-G, which is what fetuses do. They express HLA-G, and then they don't get attacked by their mums. Otherwise, the human race would not exist. So that's quite important.
Very important.
But there's another way of doing it, which what they're doing in Japan for like the past 10 years, is where you have a bank of like 100 to 200 different HLA types, and then you have off-the-shelf stem cells, and then you can just pick your HLA type and get access to it.
So yeah, I mean, this means you can't.
The allogenic one, and the last one, just quickly, is the xenogenic, and that's where it comes from animals, and you're injecting them into you.
Mm-hmm. So I mean, this means you can't go around stealing stem cells off of people, which is probably a good thing in the grand scheme of things. But can stem cell treatments help people who are suffering from chronic disease, such as obesity, type 2 diabetes, heart conditions, those sort of conditions?
So obesity and type 2 diabetes, there's no stem cell therapy for those directly, but there are lots of stem cell therapies for the consequences of those diseases, like arterial damage, cardiac damage, skin damage, etc. But yeah, nothing for the actual diseases themselves, because that's all really diet and lifestyle. But yeah, with heart disease, this is one of the most promising areas for stem cell therapy. So there's a nice paper I've linked in the notes here to this. I'll read it out. So they injected, this is the most recent one, published a couple months ago. They injected cardiosphere-derived cells. So these are cells which, stem cells for the heart, they give rise to like cardiomyocytes. And then they injected these into the coronary arteries. So there's the arteries in the heart of patients with heart disease. It didn't reduce scar size in these patients who had they'd had a heart attack, and then they did the injection afterwards. But it did reduce left ventricular volume, which is a marker of damage after a heart attack, and also NT-proB natriuretic peptide, which is also a very well-validated marker of heart disease. So it reduced both those things, and there's a lot of other trials with similar therapies, either those cardiac stem cell therapies or mesenchymal stem cell therapies, which have shown good outcomes in randomized controlled trials for heart damage.
In that instance, do they sort of speculate on the actual mechanism or pathway of how these stem cells actually provide a therapeutic effect?
Yeah, so with MSCs, it's more anti-inflammatory and paracrine and changing the immune system to a more regenerative state. Whereas with cardiac derived, cardiosphere-derived cells, so cardiac stem cells, then it's more about actively replacing the lost myocardial or epicardial tissue. So ideally, might be both those in combination.
And so you mentioned a couple of different stem cell sources, and would getting stem cells from, say, maybe umbilical versus blood or fat tissue, is there better sources of replacement cells than bone marrow? So I know that bone marrow is a very ubiquitously used source of stem cells for when it comes to treating sort of neurodegenerative diseases and other degenerative diseases.
Yeah, so the best source for any health problem is the one that has the most evidence. So you have to look at the randomized controlled trials that have been done, and there's going to be a different set of diseases that mesenchymal stem cells, MSCs, hematopoietic stem cells, HSCs, or umbilical cord stem cells are going to have an effect on. So I did a quick review of the randomized controlled trials, which have been done and have been shown mostly to be effective out of this list for umbilical cord stem cells. And I'll put the link for that search I did in here as well. So there have been RCTs done with umbilical cord stem cells for osteoarthritis, COVID-19 that is, spinal cord injury, heart disease, cerebral palsy, rheumatoid arthritis, skin scars, autism, advanced gum disease and gum recession. It's pretty cool. Facial rejuvenation, hair loss reversal, anti-transplant rejection after an organ transplant, Crohn's disease, leukemia bone marrow transplant, and lupus, multiple sclerosis, liver cirrhosis, eczema, lots of autoimmune stuff there as well.
Really wide range of conditions there, isn't it?
Yeah. That's all randomized controlled trials as well. So, no case series or case reports. It's quite good evidence.
So what is the relationship between stem cell treatments and organ rejuvenation? Can we replace or restore lost organs using these techniques? Or can we even make new organs that are better than the originals?
Yeah, so in theory, you can regenerate every organ with stem cells if you have the right combination of stem cells and they manage to stick into the organ and stay there and survive and function properly, and they're not rejected and they go to all the right places. But yeah, we can make organs that are better than the originals because you can genetically modify these stem cells before you inject them. So then you can have better genes. So you could replace, make new genes entirely, or you could make better versions of genes that you have bad versions of.
Yeah, well, I mean, that sounds incredible, really. Well, I mean, there must be some sort of limitations with these. It can't be all good news. Otherwise, we'd be using them for all this stuff already. So what are the main sort of drawbacks with this?
Yeah, so it's really technological drawbacks, I think, is the main barrier, because the theoretical potential for them is very, very, very good. But some of the logistical technological drawbacks include one, that immunogenicity, so risk of causing a mismatch between people and an immune response. That's a big one. But being able to actually grow them up in a bioreactor at scale, at the doses needed for a population, that's quite hard. Although they have done that in Korea already for quite a few years. Targeting, so getting the cell to the right place. So you have to have quite complex image-guided injection training to do that in a lot of cases, especially in like complex spinal joints. That's very advanced stuff. So that's a training issue, and access to ultrasound and fluoroscopy on the clinician side, and also just the way the therapy is designed, whether it survives once it's being injected in, and whether it takes. So if it's in a very inflammatory environment, like you're injecting into a smoker, then it may not take as well as if it's being injected to someone that's had a few other level 3 therapies and level 1 or 2 therapies already. So,
yeah, I think they're all things we're getting better and better at it, really, aren't we? Almost with every year that goes past, there's some sort of improvement to a protocol that increases the amount that we can do with these sort of unbelievably regenerative cells. Yeah. So if you're looking for to partake in a trial using stem cells, or you wanted to have a look at what treatments we have out there, how would you go about finding a stem cell clinic that you actually trust? Because I'm sure there's so many out there that are maybe just looking for a quick buck, using that stem cell status,
or chiropractors injecting dead fetal stolen tissue.
Oh yeah, there we go.
USA. Yeah.
I'm sure there must be countless examples. And if you are going out looking for them, is there any red flags that you would see personally that might sort of make you a bit hesitant on trusting that particular clinic?
Yeah, so I've got a checklist for checking out stem cell clinics on my website, my resources section, my level 3 stem cell folder. So that's obviously step one. But yeah, there's one that's always very good, which is RegenX, and that's for musculoskeletal injections only, and they use your own bone marrow MSCs and adipose MSCs and PRP, platelet-rich plasma, different combinations of them, using ultrasound and fluoroscopy as X-ray guided injections, and they have all their clinicians are like super trained, with I think hundreds and hundreds of hours of training to do this, and they have a network of clinics in USA, in the islands outside USA, and also in Europe and UK now as well recently. So they're one I do trust. Others, it's kind of like hit and miss a lot more. So you want to critique them a lot more and use my checklist. And you should also check that they're, appropriately registered with their regulators, so FDA or Care Quality Commission in the UK. And you want to ask for the full procedure step by step, and then get it reviewed by a specialist stem cell doctor, medical doctor, not a chiropractor doctor. And then, so you can send it to me, for example, and I could help you work through the checklist, because there's quite a lot of, it is a bit complex because a lot of new terms, a lot of new terminology.
Yeah, I think that's some great advice there. So we've talked about replacing or restoring lost whole cells, but let's go a bit more granular than that and talk about lost parts of cells, or organelles. So firstly, can you just tell us what an organelle is, and how would you define organelle replacement therapy?
Yeah, so you've got a cell, and then inside the cell there's the nucleus and the lysosomes, which they break down all the waste in the cell. Then you have mitochondria, which generate all the energy for the cell. It's like the electricity hub. And then lots of other types of little things inside the cell. So these little things are all called organelles. So there's organ, which means, and then organelle. L normally means little, I think in Latin or Greek or something, or maybe French, who knows. But yeah, it's just little organs, and they're the organs inside cells rather than the whole organs in the body. It's quite cool naming system. But yeah, so that's what an organelle is. And then the main ones that you want to focus on for replacement, because they get damaged with age, are lysosomes and mitochondria.
So what are their functions?
Yeah, so lysosomes, they're like the garbage can for the cell. They're the incinerator. So they traffic all the different waste from other parts of the cell and from outside the cell, or even bacteria. If they're white blood cells, they have lysosomes that break down bacteria and viruses. So COVID will get broken down in lysosomes often, and then viruses evolve to evade lysosomes, so they don't get broken down. So a lot of evolutionary stuff there, which is quite cool. But yeah, lysosomes the garbage can of the cell, the incinerator. Then mitochondria are the powerhouses, so they generate the energy and ATP.
So what would you do to start treating conditions that affect these organelles?
Yeah, so in terms of this type of aging damage, category 1 and level 3, restoring lost cells and cell parts. So what you can do here is just in theory, you can replace the mitochondria entirely or the lysosomes entirely. So what you could do is, so there's 2 companies working on the mitochondria for this recently. One called, is it Mitrix? Yeah, Mitrix, and then one called Cellv. And what they're doing is they're growing up mitochondria, healthy young mitochondria, in the lab, and then they're going to inject them somehow into the body. And they may encapsulate them so they're protected from the bloodstream, and that they're targeted and go to the right organs when they do inject them, or you inject them into a joint, if that's where you want to target particularly, or into an organ itself. And then these mitochondria will be delivered to inside the cell, and then they'll start, working and be activated, and they'll help replace and outcompete the existing dead mitochondria, which is pretty cool.
So I presume the old ones just sort of get, replaced and then recycled.
Yeah, so a lot of, I think it's about 50% of what goes to the lysosome, the cellular incinerator, is actually mitochondrial components, because I guess they've got the highest entropy in the cell, because it's where all the, there's a lot of energy in that. So there's going to be a lot of damage and a lot of waste components which need high turnover. It's like the engine of a car.
And is this uptake of mitochondria, is that quite efficient? Because I imagine, it's not too easy to just inject mitochondria and get all the cells to suck up these healthy mitochondria. So, is it a bit of a process to get it to work successfully?
Yeah, so it's going to be very hard, targeting stuff. So, for example, a lot of vaccines, they use lipid nanoparticles. So the COVID vaccine recently, the mRNA ones, They use the Pfizer and the BioNTech ones, and Moderna. They use lipid nanoparticle encapsulation of mRNA. So that's increasingly a globally recognized delivery solution for stuff. So yeah, it could be reasonable to assume they might use. We don't know yet because it's a very early stage of these companies, but yeah, maybe they'll use lipid nanoparticles to encapsulate the mitochondria, and then that will keep them safe in the bloodstream, and then they'll be released once they're inside the cells, where it's a safer environment that they're naturally used to.
So going from the tiny organelles to a macro level organs, in the future, will we be able to replace organs like the heart and kidneys?
Yeah, so we already can replace the hearts. There's like quite a few prosthetic hearts out there that have been around for a while, and we use obviously organ transplant from other people has been around for ages and ages and ages. So whether that's transplanting bone marrow in leukemia, or heart transplant in heart failure, or liver transplant, kidney transplant, corneal transplant, retinal transplant. There's like a lot of, well, not retinal transplant. Maybe that's done recently. I can't remember. But yeah, there's a lot of organs you can do where you don't grow it in the lab.
Mm-hmm.
But increasingly, it's becoming possible to grow organs in the lab, actually at full size. So you either grow it from scratch and it gets bigger, or you take a skeleton, which you either 3D bioprint, like an organ skeleton, which is like the thing that all the cells in the organ sit on, and you get that either from animals, and you decellularize it and wash off all the animal cells. Like pigs' hearts are quite the same shape and size as humans, so that could be one example. And then you seed it with allogenic or autologous cells, like we were discussing earlier, and then it grows that way as well. That's another way. Or 3D bioprinting, that's the third way, and that's where you actually print it, in real time in the real
layer
spine.
by layer.
It doesn't get bigger, layer by layer.
Mm-hmm.
Yeah, good. Like, there's good progress in all of these. There's actually there's the biological stuff, but then there's the prosthetic stuff. So you could have a prosthetic version of any of the 7 to 8 organs, and or a biological version that's been grown in the lab of any of the 7 to 8 organs, which are all going to happen in the next couple of decades for most organs.
So what happens when we get to the stage when we can successfully make any of these organs, put them into someone or replace an unhealthy organ? People are just going to, never get sick again? What's going to happen?
Yeah, pretty much, probably, because it'll be, but yeah, it'll require, so one of the main barriers is major surgery. So you don't want to do major surgery every year, because that's like an inherently risky thing currently, like at least for quite a long time, I'd say. So one way around that maybe is what's been done already actually in a few studies, is in vivo bioprinting. So it's like minor surgery rather than major surgery. So rather than like major surgery of heart transplant, that's pretty major surgery. Instead, you stick in like a few small small surgical channels, and then you 3D bioprint inside the body.
Oh, wow.
And you like retrofit and replace the current cells, possibly with lasers. So you ablate or remove the current tissue using lasers, and then you have that'll be like one port into them, and then another port will be where you're 3D printing those stem cells, which are biologically age 0 and genetically matched and genetically enhanced, into the right place in the right combinations, and with the right extracellular matrix structure as well, because the ECM, or extracellular matrix, is super important when you start doing 3D stem cell therapies.
So we've talked about some pretty amazing science and technologies here. But when will restoring stem cells or replacing organelles or replacing whole organs become a technology which is available for the general public?
Yeah, so we're starting with cells. It's actually already been available commercially, off the shelf, allogenic knee osteoarthritis for the knee, normally, mesenchymal stem cells. So you can get them from Korea the past few years. It's been like Korean FDA approved. You just buy it online, last I checked. That's been around already. But yeah, in terms of like it coming to UK or USA, you can already get a lot of autologous cell therapies legally. So that's kind of all sorted already. The autologous stuff, it's all available. But yeah, the Korean one is allergenic. That's why it's a big deal, because it's grown off the shelf. So that's cool. I think they have a similar one in Japan, but it's quite hard to look into Japan. Don't know why. They're very. It's hard to translate a lot of the stuff on the website probably. But the organ stuff, yeah, I think there's a lot of prosthetics already. Like prosthetic retina came out, I think last year. It's pretty cool. And then these are all predicted, to increase superlinearly, exponentially, in terms of like how their failure rates, their organ function output, their safety, their resolution in case of the retina. So like how many pixels you get or what functions you get. So yeah, like a lot of them are available already, like more than you think. But it's really going to be, so in terms of stem cell therapies, it's predicted that by 2029 to 2031, in developed countries, stem cell pharmacies will be widely available, which is pretty cool.
Yeah, very cool. Very cool indeed. So in your opinion, are there any, are there some proposed future uses of stem cell therapies or organelle replacement technology, in your view, which aren't fully recognized yet?
I think so yeah, autoimmune disease in general is quite a safe bet. That's kind of a niche area. Like it's not as common as you think, autoimmune disease. That's actually like compared to other stuff. But then yeah, in terms of age, like clearly age-related diseases, heart disease is very promising. That's probably the number one on my list, as well as musculoskeletal stuff like osteoarthritis or bone damage and bone fractures. But that's kind of already been proven. So there's like 30, 40 randomized controlled trials in that already. So it's kind of proven already that it outperforms everything else most of the time. But yeah, for the new thing coming up, it's heart disease and stem cells, in my opinion. Great.
And is there any advice to anyone who is thinking of getting a stem cell or organelle replacement therapy? And what would it be?
Yeah, speak to me and we can go through this checklist of critically appraising clinics and providers and whether they're safe and legal and efficacious.
Cool. And finally, I suppose one of the biggest questions is, will this be able to reverse aging, with this technology, with this knowledge, in your opinion?
Yeah, so one of the interesting, unique things about this category of therapy in level 3 is that you can actually solve all 9 categories at the same time. So if you grow up a young organ, it's not going to have any of the other 8 types of aging damage in it, just because that's how it works when you grow up a young organ with cells that are biologically age 0. So yeah, it's the most powerful out of all of the therapies because it can cure the category 1 in level 3 can solve all 9 categories of level 3 by itself. And that's why I put it as category 1, because it's the most potentially important.
Amazing. Well, thank you so much for joining me. I think that's all we've got time for today. So Ollie, is there anything you want to plug quickly before we finish?
Yeah, check out my website. Got a lot of resources on there, a lot of free stuff, and people are welcome to join my evidence-based longevity WhatsApp group if they're keen as well.
Perfect. Well, again, thank you so much for watching, guys. Please remember to go and check out the Gowing Life website, gowinglife.com, where you can check out all the news and updates from the world of longevity. So yeah, thank you very much again, and we'll see you next week.